Today we are talking specifically about dementias that are related to alcohol or related dementias, induced dementias. And this is just talking about the prevalence. And we'll kind of start here that there is a lot more evidence and research and just data knowledge about alcohol-induced dementia, than there is drug-induced. So I'll briefly kind of talk about some drugs that have some warning signs with it or that have shown to maybe contribute to negative cognitive changes. But most of it we'll talk about alcohol-induced dementias and the prevalence with that. But just knowing that alcohol abuse is common in elders. 8% have reported having a serious drinking problem. 60% report drinking regularly, and 5 to 10% report binge drinking. And on these reports and these statistics, I don't know, quite honestly, how many people are telling the truth on these either. So got to keep that in mind. But we are seeing that alcohol contributes heavily to dementia and brain damage. And it may account for 10% of dementias in persons that are younger than 65. So we're seeing a higher prevalence in this in earlier onset dementias of this alcohol-induced type dementia. And just to define a little bit, when we say binge drinking, there typically say binge drinking is 5 or more alcoholic drinks for males and 4 or more for females at the same time or within just a couple of hours of each other at least 1 day per month. So you're drinking heavily 1 day per month at least. And then we'll say heavy alcohol use or long-term use or abuse of using alcohol is binge drinking. That's 5 or more drinks. Binge drinking, 5 or more days in the past month. So you are binge drinking at least once a week for a month for it to be considered a heavy alcohol use. And looking at this brain, so you see the normal 43-year-old brain and then a 43-year-old who has alcoholism. And for those of you that have been in our programs in the past and we show you a picture of a healthy brain and a picture of somebody with late-stage dementia, this picture is similar to that. There is some serious damage that's caused by alcoholism. In alcohol, I think it's widely known that alcohol does kill brain cells and it causes severe damage, permanent damage to the brain. On top of that, it causes blurry vision, slurred speech, poor judgment, poor decision making, and memory loss as well. So research shows that it shrinks certain parts of your brain too. In some of the areas of the brain that is shown it's shrinking is the hippocampus. And the hippocampus is an important part of our learning, our memory, and being able to learn anything new. It's also, when we're talking about Alzheimer's disease, the first part of the brain that's being attacked in Alzheimer's disease. So you see some similarities in the symptoms of these two dementias. Quickly, I'll talk about drug use in dementia, and really a lot of the drug use that they're talking about is tobacco and smoking, and then alcohol. These are all drugs, right? But a long-term use of tobacco, alcohol, and benzodiazepines have been shown to have negative cognitive consequences. Benzodiazepines, it's a medication that works in the central nervous system, and typically it is prescribed for things like anxiety and seizures, but I think it's mostly prescribed for people that are coming off alcohol withdrawal or going through a detox system as well. But if you have a long-term use of that, it has shown to have negative consequences on your brain. There's not as much data out there to show that there's a direct correlation. So really these are, what it's saying is that it can help contribute to the cause of dementia, but they don't have a specific drug-induced dementia diagnosis yet because there's not enough data, whereas we do have a specific alcohol-induced dementia diagnosis. And there are health programs that are designed, obviously, to stop tobacco use, smoking, harmful alcohol use that can really decrease the burden of any type of cognitive impairment or cognitive changes that can happen in dementia in later life. And I'll quickly kind of summarize this page here, but talking about the use of Benadryl and Tylenol PM, or talking, the use of antihistamines and maybe some over-the-counter sleep aids, which is fairly common with the elderly population. But it is reported that the ingredients in those medications have a cumulative effect in the brain that may cause as much of a 54% increase in the likelihood of dementia or Alzheimer's in persons who use it regularly. So this was published by JAMA in 2015, and 11% of Americans that are 65 and older have Alzheimer's disease or dementia. A big increase in the likelihood of getting dementia is important by using these over-the-counter medications. But before we all panic, this has been shown that there's not a relationship to cognitive changes or cognitive impairment if those medications are used for 3 months or less in a continuous time frame. But if you are using it for 3+ years at higher doses, there is significant risk for increase in cognitive impairment. So using them, because I know a lot of people might use Benadryl or Tylenol PM to help us sleep, or allergies or something like that. So using them for a very short period of time, talking to the doctor and the pharmacist hasn't shown a lot of damage or negative things to happen cognitively wise, but a longer term use, and even 3 months can cause some damage or some irreversible changes in your brain. So being aware of that. And there are other newer kind of antihistamines that might be able to work, or sleep aids that if you talk to your doctor and work with your particular situation, that may be better for you. So talking about alcohol-related brain disorders, and this is, again, it's caused by chronic years of heavy drinking. So long-term heavy drinking, and there is direct damage related to the exposure of drugs and alcohol. We know that alcohol is directly causing the damage to the brain. In 2018, the CDC reported 17% of the adult population reported binge drinking and 6% reported heavy drinking. Again, how many people are really telling the truth on these reports? And then Holly had this out in one of her other presentations a while ago, and I just wanted to bring it up. But 2020 changed a lot for us, and the effects of the pandemic. So the prescriptions for antidepressants and anti-anxiety medications went up by 34% in 2020. And alcohol sales were up by 41% in women and 54% in men. So I think these statistics are a little bit higher now when it comes to alcohol and drug use. I'm going to watch this quick video about what is alcohol dementia.
I've been asked about the phrase alcohol dementia. I've been asked what is about alcohol the dementia? Phrase alcohol dementia. The alcohol dementia. And what is alcohol refers dementia? To a brain disorder that can occur through long exposure to alcohol. That can occur through long exposure to alcohol. Alcohol dementia you generally see in people who have been abusing alcohol at high levels for a very long time.
I do not know what just happened there. I'm going to start over. Please bear with me. Here we go. Sorry about that.
I've been asked about the phrase alcohol dementia and what is alcohol dementia. The alcohol dementia refers to a brain disorder that can occur through long exposure to alcohol. Alcohol dementia you generally see in people who have been abusing alcohol at high levels for a very long time. People don't get alcohol dementia early on in their alcohol abuse. Again, alcohol dementia only occurs over the course of a long time. So you often see alcohol dementia in people who are a bit older, Alcohol dementia, like other dementia, is an impairment in cognition, where there'll be a change in the brain's functioning, and usually it's a permanent change because of the death of actual brain cells and the changes in the vascular structure of the brain. In other words, the blood flow to the brain changes, and it causes the dementia, which can show in people by them over time, just like in other dementias, through memory loss, through lack of recognition, of other people and of their own experiences. Alcohol dementia is chronic, it's permanent, and it's, again, in the extreme forms of long-term, severe alcohol use.
Here we go. So alcohol, again, this type of dementia, there's several factors to it, because not only is it killing brain cells, right? And as the gentleman just described about the vascular impacts that it has on us, it also depletes our body of nutrients. And when our body doesn't have the nutrients to function, the brain's not getting the nutrients that it needs. And it just causes even more complexities and challenges to the brain. So there was a 5-year study that concluded heavy alcohol drinking is an alcohol use disorder is a main contributor to brain disorders like Alzheimer's disease and early onset dementia. This study was published in the Lancet Public Health Journal, but it's saying alcohol abuse is one of the most significant preventable factors in a dementia diagnosis. And it's especially important for those types of dementia that were started before or younger, the age of 25. Also led to more premature deaths. So consuming large amounts of alcohol prevents the neurons from regenerating, so they die. That's why alcohol kills brain cells. While it can begin in anyone who struggles with alcohol use, this condition does become more common in middle-aged and older adults, because it does take a while, I guess, for it to build up, right? So the effects on the brain, and again, heavy alcohol use is saying 4 drinks a day for women and 5 drinks a day for men. But what it does is it produces ethanol in a metabolite, acetaldehyde. I don't know if I'm saying that right, I apologize. But it has a neurotoxic effect that causes permanent structural damage and functional damage to the brain. It's also a risk factor for other brain disorders like epilepsy and head injuries that can also lead to dementia. Another thing that heavy drinking and alcohol is there are a lot more car accidents, right? And car accidents lead to brain injuries along with other injuries as well, and deaths. It also results in high blood pressure, irregular heartbeats, strokes. So it does have a major effect or association with cardiovascular issues and a vascular dementia because of the blood flow that's getting through the brain. And then, of course, a number of other health concerns. When we tend to drink and have heavy alcohol drink, again, so we're using poor judgment, poor decision-making skills. So typically what happens is somebody will pick up a cigarette or they'll pick up another type of tobacco. Depression is also a high risk or association with this. Addiction to not just the alcohol, but to other illicit drugs as well. And all of these factors also increase your risk to develop dementia. So not only just the risk increase for drinking heavy use of alcohol, but all these other factors that typically people tend to pick up on when they're drinking. So just a quick kind of side note, this is a risk factor warning. Because I want us to think, we have talked before, and there is some study that shows that drinking like wine, like 1 glass of wine a day can be protective. There's some antioxidants in there. And while there is data to show that, what I want to really kind of stress is that if you're drinking more than recommended, that really just increases your risk for dementia. Whether you're binge drinking or not, you're just drinking more than what's recommended, then you have an increased risk for developing dementia. Okay. The recommended limit to drinking is 14 drinks a week, which really comes down to it's a maximum of 2 drinks a day. So what this is saying is you can't just build up and wait until Saturday night and drink all of your 14 drinks in that one day, because that's binge drinking. So you want to, if you are doing this, keep it at most 2 drinks a day. And that's the recommended limit for alcohol. And then, of course, any long-term use of smoking or using other types of tobacco is going to increase your risk for dementia as well. Just kind of want to be a little side note soapbox on that. So symptoms that come with alcohol-related dementia are very similar to the symptoms of Alzheimer's disease. So there are memory loss issues, there's impaired judgment, inability to perform motor movement tasks or complex motor movement tasks like dressing as well. You can have nerve damage in your peripheral, your extremities, your arms and your legs. This can be called peripheral neuropathy, where there's pain or tingling in that. But it also, what this does is it damages the cerebellum, alcohol use. And cerebellum really controls our coordination and our muscle movement. So when you have damage in that, you're going to see some more motor movement problems pop up. So when you have more motor mover problems pop up because the cerebellum's being damaged because of the alcohol use, you are at a higher risk for falls. Falls, you're at a higher risk for brain damage or traumatic brain injury, right? And then when you have that injury to the brain or the trauma to the brain, then you also have a decline in cognition and functioning. Alcohol also damages the heart and the liver. I think most of us know that. There's no secret there. But commonly, not only are you seeing changes in the brain, but there's abnormalities in the liver and the heart, and it's termed alcoholic cardiomyopathy. And the heart damage may produce additional brain complications because now you're not getting the blood flow and the nutrients and oxygen that your brain needs. So really, there's just no good that comes of drinking too much, right? Some other symptoms that come with alcohol-related dementia that are more on the psychiatric side of things can be psychosis, depression and apathy, anxiety, irritability, resisting help from others, and then personality changes. It can also be shown as they're impulsive and can have hostile behavior to a point where there's medication that needs to be prescribed to manage those behavioral changes. With this particular dementia, you might see these psychiatric problems develop first before you see any cognitive or memory changes or even any intellectual changes in some people. So like the word dementia, where there's a group of symptoms, it's kind of a broad term with a lot of different types of dementia underneath that. Alcohol-related dementia is the same. It's a broad term, and there's several different types of alcohol-induced brain damage that happen with this that can affect a person. And those symptoms are varied. Like I just said, there can be motor movement problems, there can be psychiatric problems, and there's problems that are similar to Alzheimer's disease, right? Wernicke-Korsakoff syndrome is a more specific condition, and it is really associated with thiamine deficiency. So if I'm talking about alcohol-related or induced dementias, this Wernicke-Korsakoff syndrome is the most prevalent of the alcohol-related dementias. And really, it's a combination of two different types, two different conditions. There's the Wernicke's encephalopathy and a Korsakoff's dementia that 99% of the time they occur together. They can occur independently, but most of the time they occur together, or Wernicke's starts first, and if that's not treated in time, then Korsakoff's dementia pops on or comes on because that was not treated well. And Wernicke's encephalopathy is really not caused directly by the use of alcohol. It's a thiamine deficiency or a vitamin B1 deficiency. The deficiency in this vitamin is caused by an excessive alcohol use. Also can be caused by vomiting. It's really, they're becoming malnourished. They're not getting the thiamine or the B1 that the body needs. And with regular drinking, the body cannot store up the thiamine and it gets depleted fast. Our brain needs thiamine to work because it helps the brain cells produce energy from the glucose. And if it doesn't have that thiamine to produce the energy from the glucose, the brain cells are not going to be able to function properly. So this looks like stumbling, a loss of coordination. So you'll see some motor movement disorders or problems happen here, but also an abnormal eye movement. And that can be where both eyes are moving side to side really fast, or just one eye is moving side to side. And there can be double vision, confusion, and then if this Wernicke's encephalopathy is not treated in time, or it goes on without being treated, then Korsakoff's dementia will set in. And this is directly related to the alcohol because it prevents normal cognitive functioning, which does lead to dementia. And there are permanent changes that come along with the Korsakoff dementia. And these symptoms are related to memory loss, inability to speak normally, confusion, depression, and other permanent cognitive changes in the brain. Hallmark symptoms are things that help us diagnose Wernicke-Korsakoff syndrome. There's long-term gaps in the memory or gaps in the long-term memory, and they fill it in with this confabulation, or they're making up detailed stories about what's missing. They're not able to learn any new information. And then, of course, there's that balance issue or a loss of muscle coordination, that abnormal eye movement or sight issues, and then mood swings. About this, it is possible for this form of dementia to clear up if somebody stops drinking. So if they abstain from drinking. But however, it can become a permanent chronic dementia, especially those of the elderly who have been abusing alcohol for a long, long period of time. So let's watch a short video specifically about Wernicke-Korsakoff's.
Another neurological disorder affecting memory is Korsakoff syndrome, which is caused by a lack of vitamin B1 or thiamine in the brain. This disorder is strongly linked to severe malnutrition, eating disorders, or especially alcoholism, because these groups often don't ingest or are unable to process all the nutrients their bodies need, including thiamine. Thiamine is important because it's responsible for converting carbohydrates into the glucose your cells need for energy. And it's especially important for the normal functioning of your neurons. At first, a person developing Korsakoff syndrome might have damage to certain parts of the brain, resulting in poor balance, abnormal eye movements, mild confusion, and/or memory loss. At this stage, it's actually called Wernicke's encephalopathy, which is the precursor to Korsakoff syndrome. If Wernicke's encephalopathy is diagnosed in time, then it's possible to reverse the damage, or at least prevent more of it. If untreated, however, the disease will progress into full-blown Korsakoff syndrome. The main symptom of Korsakoff syndrome is severe memory loss. And this symptom is often accompanied by confabulation, which is when the patient makes up stories, sometimes to fill in the gaps in his or her memory. Unlike AD, Korsakoff syndrome is not necessarily progressive. If diagnosed and treated, people can get better. People are often treated with thiamine injections or other medication, and they have to stay on a healthy diet and abstain from alcohol. And some people may also need to relearn some things. The effectiveness of this treatment really depends on how early the disease is diagnosed and how well the patient follows the treatment guidelines.
So the video talks a little bit about treatment and getting a diagnosis. And to get a diagnosis of alcohol-related dementia really does require, just like with any dementia, kind of a ruling out process and requiring a lot of different exams, but particularly a clinical and medical history, and maybe even family history of the person. How long has this behavior of drug use or alcohol abuse they've been using or doing? or drinking. A patient, however, if they're already going through withdrawal or a detox program, or they're experiencing other medical complications because of the abuse, the substance abuse, like liver failure or a GI bleed, they're not really able to be diagnosed because there's too many other complications that can muddy the picture for a diagnosis. So really what we have is we have an underdiagnosed, this dementia is underdiagnosed. Doctors generally don't recognize alcoholism in the majority of elderly patients. And then there's that attitude of, oh, just let Granny have her drinks. She deserves it, just let her have them. She's earned it, right? And that attitude, while to a point I think is fine, it can prolong drinking, especially if there's already been abuse has occurred. And then the changes associated, brain changes, are really kind of nonspecific. And sometimes it's thought as intellectual loss more than a cognitive loss. So there's some confusion about how the symptoms present in different people. Again, it's varied in each person. And unfortunately, brain imaging or other clinical studies aren't as helpful to distinguish or highlight an alcohol-related dementia. But neuropsychological testing does help quite a bit to help clarify the diagnosis. And this is, the testing for attention span, memory loss, visuospatial tests, things like that. Can help maybe distinguish or at least have alcohol-related dementia as part of a mixed diagnosis. And then treatment for it is, the best treatment is sobriety. There is the possibility of somebody that stops drinking for them to get better, maybe not going back to where they were before they were drinking, or if they never drank, but it can get better, or they can maintain for a longer period of time, especially if it gets treated earlier on. When we're talking about in that Wernicke's encephalopathy before the Korsakoff's dementia, and then it's a full-blown syndrome that they're living with. The vitamin replacement therapies, infusions, management of other nutritional needs, and then of course management of other medical problems, other problems with the heart or the liver, or the lungs that needs to be managed to help manage the dementia, the alcohol-related dementia. And ongoing attention to any heart and liver. I would like to add lung function there too. Long periods of sobriety for patients with alcohol-induced dementia can result in slow, small improvements. And this was shown on, if you're testing for somebody that has Alzheimer's disease and you're using the mini-mental state exam, which is a typical assessment used. For persons with Alzheimer's disease, they may lose 2 or 3 points on that mini-mental state exam per year. But if somebody that has alcohol dementia and they stop drinking and doing some other treatment measures, the patient may regain 0.5 point per year if they're sober and managing their other problems well. It is well established that alcohol use disorders and overall health and well-being, in fact, contribute to a shorter life expectancy by more than 20 years. With treatment and recovery, many of the ill effects of alcohol abuse are diminished, and patients can see a significant boost in their physical and mental health. So it really is important. This is one of the dementias that has more treatment options for it. And can maintain for a longer period of time. So getting help for any drug or alcohol use disorder. Of course, there's rehab centers and treatment centers, and talking to a medical professional, therapists, counselors, or other professionals that offer social support to help not only with the treatment, but help maybe get to the point of why you started abusing the alcohol and drugs in the first place. Most of the time, there's another cause why that started, or how the addiction was triggered. And here are listed are just a few things or a few places you can go to get more information about what alcohol does to the system, what drugs does to the system, and how to get treatment and recovery through that. And of course, you can always call the West Center. I'm going to stop sharing. And now I know we're 1 minute over, but does anybody have any questions or comments or anything?
Hey, Jamie, I think you're, if I'm not mistaken, your body with a urinary tract infection or your body can produce sugar, which turns into alcohol. Is there anything on that's put out on sugar intake turning into alcohol and messing up?
I didn't. Yeah, I did not see anything like that. But that might have been a more specific search,
Yeah.
right? But yeah, how the body metabolizes sugar, and if there's other complications, yeah, they're another infection. For sure.
It produces alcohol, is what I thought.
Okay.
I
don't know. That's something to look into. All right, well, I appreciate your time today. And again, you'll be getting a follow-up email with the slides from today, a recording, and information on our upcoming programs. We appreciate it. Thank y'all so much.
Thank you.